Seasonal allergies. These are among the most widespread allergic conditions in the world, affecting hundreds of millions of people each year. They are triggered by airborne pollen from trees, grasses, and weeds during specific times of the year. In spring, tree pollen is usually the main culprit. In summer, grasses take over. In fall, ragweed dominates in many regions. When a person with seasonal allergies inhales pollen, their immune system mistakenly identifies it as a threat and launches an inflammatory response. The result is sneezing, a runny or stuffy nose, itchy and watery eyes, and sometimes a scratchy throat or cough. The symptoms can range from mildly annoying to severely disruptive, affecting sleep, concentration, and quality of life. Treatment typically involves antihistamines, nasal corticosteroid sprays, and avoiding outdoor exposure during peak pollen times. For people with persistent symptoms, allergen immunotherapy, either through regular injections or sublingual tablets, can gradually retrain the immune system to tolerate the allergen over time.
Food allergies. These occur when the immune system reacts to a specific protein in a food as if it were harmful. The most common food allergens include peanuts, tree nuts, milk, eggs, wheat, soy, fish, and shellfish, though virtually any food can cause an allergic reaction. Symptoms can range from mild, such as hives, tingling in the mouth, or stomach discomfort, to severe and life-threatening. The most dangerous reaction is anaphylaxis, which can cause throat swelling, a dramatic drop in blood pressure, difficulty breathing, and loss of consciousness within minutes. Food allergies are most common in children, and many children outgrow allergies to milk, eggs, wheat, and soy by school age. Allergies to peanuts, tree nuts, fish, and shellfish tend to persist into adulthood. Currently, the only reliable way to prevent a reaction is strict avoidance of the trigger food. People with known severe food allergies are advised to carry an epinephrine autoinjector at all times. Research into oral immunotherapy, which involves gradually exposing the patient to tiny amounts of the allergen, is showing promise, but is not yet a routine treatment.
Ischemic stroke. This is the most common type of stroke, responsible for roughly 87% of all cases. It occurs when a blood clot blocks or narrows an artery leading to the brain, cutting off the supply of oxygen and nutrients to a specific region. Within minutes, brain cells in the affected area begin to die. The clot can form directly inside one of the brain's arteries, often at a point where plaque has built up over time. Or it can travel from elsewhere in the body, typically the heart or the large arteries of the neck. The symptoms depend on which part of the brain loses its blood supply. One person may lose the ability to speak, while another may experience sudden weakness on one side of the body or lose vision in one eye. Time is critical with ischemic stroke. There is a narrow window, usually 4.5 hours, during which a clot-dissolving medication can be administered. Every minute of delay means more brain tissue lost. Beyond medication, procedures to physically remove the clot have become increasingly effective, extending the treatment window in some cases to up to 24 hours.
Insect sting allergies. These involve an exaggerated immune response to venom injected by stinging insects, most commonly bees, wasps, hornets, yellow jackets, and fire ants. Most people who are stung experience temporary pain, redness, and swelling at the sting site, which is a normal local reaction. An allergic reaction goes far beyond this. A large local reaction causes swelling that extends well beyond the sting site and can last for days. A systemic reaction affects the entire body and can include widespread hives, facial or throat swelling, difficulty breathing, rapid pulse, dizziness, and a sharp drop in blood pressure. Systemic reactions can progress rapidly to anaphylaxis and can be fatal without prompt treatment. An estimated 5% of the population is at risk of a systemic reaction to insect stings. People who have experienced a severe reaction should carry an epinephrine autoinjector and consider venom immunotherapy, a highly effective treatment that involves regular injections of purified venom over several years to desensitize the immune system. This treatment reduces the risk of a future severe reaction by over 90%.
Pet allergies. These are caused not by animal fur itself, but by proteins found in an animal's skin cells, saliva, and urine. When these proteins become airborne and are inhaled, or when they contact the skin, they can trigger an immune response in sensitized individuals. Cats and dogs are the most common sources, though allergies to rodents, birds, and horses are also well documented. Cat allergens are particularly potent and persistent. They can remain in a home for months after the animal has been removed and have been found in buildings where cats have never been. Symptoms typically include sneezing, runny nose, itchy eyes, coughing, and sometimes skin reactions. For people with asthma, pet exposure can trigger wheezing and difficulty breathing. The most effective treatment is avoidance, but for many people, giving up a pet is emotionally difficult. Keeping the animal out of the bedroom, using air purifiers with HEPA filters, and washing hands after contact can reduce exposure. Antihistamines and nasal corticosteroids manage symptoms, and immunotherapy can provide long-term relief for some individuals.
Latex allergy. This is a reaction to proteins found in natural rubber latex, a material derived from the sap of the rubber tree. Latex is used in many everyday products, including medical gloves, balloons, rubber bands, and some clothing. People at highest risk include healthcare workers who regularly wear latex gloves, patients who have undergone multiple surgeries, and workers in the rubber manufacturing industry. Repeated exposure increases the likelihood of sensitization. Reactions range from mild contact dermatitis, which causes itchy, red, or dry skin, to immediate allergic reactions with hives, nasal symptoms, and in severe cases, anaphylaxis. An interesting aspect of latex allergy is its association with certain food allergies, a phenomenon known as latex fruit syndrome. People allergic to latex may also react to bananas, avocados, chestnuts, and kiwi because these foods contain proteins structurally similar to those in latex. The primary treatment is complete avoidance of latex-containing products, and the widespread switch to non-latex gloves in healthcare settings has significantly reduced new cases.
Contact dermatitis. This is a type of allergic reaction that occurs when the skin comes into direct contact with a substance that triggers an immune response. Unlike other allergies that involve inhaling or ingesting an allergen, contact dermatitis is strictly a skin-level reaction. The most common culprits include nickel, found in jewelry, belt buckles, and zippers, poison ivy, oak, and sumac, fragrances and preservatives in cosmetics, and certain chemicals used in hair dyes and cleaning products. The reaction does not happen immediately upon first exposure. Instead, the immune system becomes sensitized over time, and symptoms appear on subsequent contact, usually within 24 to 72 hours. The affected skin becomes red, itchy, swollen, and may develop blisters or a rash that closely mirrors the shape of the object that caused the contact. Patch testing, in which small amounts of common allergens are applied to the skin under adhesive patches, is the standard method for identifying the specific trigger. Avoidance of the identified substance is the most effective treatment, supported by topical corticosteroids to manage flare-ups.
Anaphylaxis. This is not a type of allergy, but rather the most severe and dangerous manifestation of an allergic reaction. It is a rapid, whole-body response that can occur within seconds to minutes of exposure to a trigger. The most common causes are foods, insect stings, medications, and latex. During anaphylaxis, the immune system floods the body with chemicals that cause blood vessels to widen dramatically and blood pressure to plummet. The airways can narrow due to swelling, making breathing extremely difficult. The skin may develop hives or flush red, and gastrointestinal symptoms like nausea, vomiting, and abdominal pain can occur simultaneously. Without immediate treatment, anaphylaxis can lead to unconsciousness and death within minutes. The first-line treatment is an injection of epinephrine, which rapidly constricts blood vessels, relaxes airway muscles, and stabilizes the heart. This is why people at risk are prescribed epinephrine autoinjectors and instructed to carry them at all times. Even after epinephrine is administered, emergency medical care is essential because symptoms can return hours later in what is known as a biphasic reaction.
If you found this video helpful, make sure to hit that subscribe button and turn on notifications so you never miss a new upload.